Back to this month's edition of Managed Care TV. I'm Steve Thornley, CEO of Care National and host of Managed Care TV, and today we're excited to bring back Dr. Josh Luke. Dr. Luke is a healthcare futurist and author of Health Wealth, 9 Steps to Financial Recovery. Today, Dr. Josh Luke and I will talk about happenings here in Arizona in healthcare and also current events throughout the country on this, the June edition of Managed Care TV. Dr. Luke, welcome back to Managed Care TV.
Thanks so much for having me. It's great to be back.
Thank you. We're excited to talk about, of course, some of the latest happenings going on in your world as a healthcare futurist. But we want to start off talking about these 2 hospitals that abruptly closed in Arizona over the weekend, Gilbert ER Hospital and then the Florence Hospital. I'm going to go to a quick news clip. And
meantime, happening today, a sudden shutdown. 2 hospitals closing for good, leaving patients and doctors to fend for themselves. Ambulances told to stop bringing in patients to Gilbert Hospital. And in Florence, their only hospital there, planning to close down on Monday. ABC 15's Megan Thompson is joining us live this morning from Power and Ray, just outside the Gilbert Hospital that's going to close. So Megan, do we know why these both are closing so quickly?
Well, that announcement came actually just yesterday, Allison, and the Gilbert Hospital, their motto here is door to dock in just 31 minutes, but in about 8 hours, they're going to close the doors for good. Now, while it may seem fast to us, we're just learning both hospitals in Gilbert and in Florence have been struggling through years of financial turmoil, unable to secure new investors or owners in the past few months. Creditors forced Chapter 11 bankruptcy, and a court-appointed receiver filed a notice to wind down operations. Florence still treating patients until Monday. Gilbert is going to be done at 1 p.m. today. For those who rely on the hospitals, it's scary to think a place to get help will soon be gone.
so, Dr. Luke, Gilbert, the town has over 237,000 residents, and the town of Florence has 28,000 residents. Obviously, that was the smaller of the 2 hospitals, but what you say might be speculative. It might be firsthand knowledge, but what do you think went wrong here?
Well, it's not all that uncommon, and it's very unfortunate. You know, I have lots of friends that live out in Arizona area and Gilbert in particular, and what a beautiful physical plant looking at that hospital. And I think it's just a case of, you know, an organization that wanted to come in and build some hospitals for a community in need. But the hospital business is changing, and it's changing drastically, as you know, and hospitals are actually no longer profitable businesses. And unless you have the full business model, the full structure of a health system that is an insurer with the right plans, with physicians that are aligned, it's not going to work. And I think these hospitals found that out very quickly. And there's a lot of fool's gold in healthcare right now, and you're seeing even venture capital coming out of Silicon Valley, where they're making huge misses because they've always had this model they learn in MBA school about investing, and it just doesn't work in healthcare because things don't change overnight in healthcare. But what is changing in the hospitals, which used to be incentivized for putting a head in a bed at all costs with no checks and balances, now have a tremendous amount of checks and balances. And you can't just put a head in a bed and bill somebody and get paid. In fact, it's quite the opposite. Not only do patients need to meet criteria in order for you to get paid, but now they're saying, hey, why don't you in fact become part of the insurance agency hospital? So now we're incentivizing you to keep heads out of beds and only treat patients who are sick. So there's a lot going on. It's not a healthy time to enter the hospital space, but also you look at a market like Arizona, and it's so progressive. You have some of the best health systems in the country, you know, 3 or 4 of them to name a few. You have Dignity with a huge presence out there. You have Banner Health, who's, you know, pretty dominant in that state in many ways. And Dignity actually partnered with Tenet Health on an ACO. So when you're dealing with an accountable care organization, basically an insurance entity, and competing with them as a standalone hospital, man, that's an uphill battle. There's a lot of challenges. And the last thing I'll say is the freestanding emergency departments. There's been a lot of abuse, if you will, in the state of Arizona. And some people might say, well, that's a strong word, but from the outside looking in, it is abusive when you go into a community and put an emergency department without putting the rest of the services in there. And people might say, oh no, it's a service to our community. It's the wheel and spoke philosophy, where if you go to the emergency department here, we'll transfer you over. Well, the reality is that the hospitals that put those EDs in, those freestanding EDs, just they put it right next door to their competing to a competitor's hospital instead
Right.
of putting it in an area of need. So there's a lot of things that contributed to this, and unfortunately, it's just really unfortunate for the those communities in Arizona that had a good hospital there for a while, and now it's not going to be there.
Yeah, I mean, one of the biggest things that they touted was, there you saw in the news clip that, and I saw billboards all around town, door to dock in 31 minutes. You saw the helicopter obviously on the roof there, so they were definitely trying to tap into the emergency care or emergent care market. And I guess I'm hearing from you that unless you've got deep pockets, that these doctor groups that try to get together to launch these smaller hospitals, it's just not a fitting business plan for
That was
right
a
now.
good gig, running a surgery center or a hospital, until about 5-6 years ago. When the ACA passed, the ball started rolling in the other direction with checks and balances and criteria that needs to be met. And in any time there's a little niche where a physician group or somebody else is going to be able to capitalize on a situation, the insurers and the feds catch up to it really quickly and start scrutinizing it to say, hey, this isn't what we're supposed to be doing in healthcare. We're trying to make healthcare affordable for Americans and accessible. And here we have this cash cow, yet the patients can barely afford to go there. So I just don't think it's the right time to get into the hospital industry. If you've read one of my earlier books, Execute, a former hospital CEO tells all on what's wrong with American healthcare, what every American needs to know. We talk a lot about that transition from heads and beds to a value-based model, which is an insurance model, and how drastically it's going to impact the hospitals. And until the last year or two, I don't think hospitals really felt that. In fact, I wrote on LinkedIn, and if you don't follow me on LinkedIn, please do follow Dr. Josh Luke on LinkedIn. I'll follow you back. We share stories with the folks at Care National TV and others all the time. Write for Forbes as well. And one of my recent stories was about the fact that I think what we're seeing now, looking back on the election, is most of the large health systems nationally were in a holding pattern after the Affordable Care Act passed. They didn't want to move. Why would they move? Times have been great. They're printing money in hospitals for years and years. And the hospital lobby is very powerful, always been very successful in getting anything that worked against the hospital model to be overturned or reversed. And that just didn't happen with the Affordable Care Act. So we were waiting for a GOP majority to happen. And then it happened, and the holding pattern, everybody high-fived and celebrated for a day or two, and then said, wait a minute, nothing's changing, nothing's going to change. Value-based care is here to stay. And the main reason is because there's no money left in the piggy bank. The Medicare fund is run dry. It's running dry at an alarming rate. You can't go back to a methodology where there's no checks and balances. The insurers are just taking the lead of Medicare and saying, yeah, we want to do the same thing. We want to reduce our spending. So it's not a great time to get in the hospital business. It would be great if Banner or Dignity or somebody could come in and swipe up these beautiful facilities and provide a nice community hospital for these communities, as was the intent. I have no idea if that's going to happen. It's way outside my pay grade to know that. But what I do know is when there's a beautiful facility that's ready to go and equipped, it makes it a lot more attractive to a potential buyer to come in and provide that resource for the community.
Sure. And we didn't learn it on this report, but the Business Journal, Phoenix Business Journal, reports that Dr. Timothy Johns apparently diverted about $20 million from the Gilbert Hospital to start construction on a medical center out in Peoria. And interesting picture there online is showing that Peoria Hospital just in its metal frame. They ran out of money before they could even
I read that the community actually voted it as a public nuisance and tried to have it torn down.
Wow.
But apparently there's no money left to even tear it down. So.
Yeah, and again, I think you hit right on it, is that there's just not the money in it. Like I think these doctors thought. They thought they'd open up 2 or 3 of these similar sized hospitals, and they would just be taking bags of money to the bank. And obviously that didn't happen. Do you think any of this is attributed to the indigent population coming in not being able to pay for ER services, but obviously under the law, ER services have to be provided?
I don't, and that's coming from somebody who was the CEO over 3 safety net hospitals where we largely served the homeless, the neediest of the needy, the indigent, the behavioral health patients, those that were duly diagnosed. So I have a passion for serving that community.
Sure.
But the amount of hospital bailout funds there are in this country is astronomical, quite frankly. The amount of funds that the hospital's been able to get passed at the federal and state levels to make up for all those homeless people that we're seeing is really more of a media darling than anything else, because hospitals are getting multi-million-dollar checks 2 or 3 times a year to make up for those things. And unfortunately, and I recently wrote about this as well, in my experience as the CEO over 3 of those hospitals, we would be cash poor for months and months waiting for that money to come in. And when it did, very little of it, usually less than 10% of it, would actually be returned into the operation or into the physical plant. It would mostly be, passed on to ownership and split up. And unfortunately, that's just a common trait. So one of the things I question quite a bit, honestly, is why are privately owned hospitals still subject to these funds? If the privately owned hospitals are going to pocket the money, and if there are non-private owned hospitals that are county or state owned or not-for-profits that are really supposed to be in it for this reason, why aren't we transferring those patients and that burden over there? So there's a conversation to be had there, and I think that conversation's coming, but it's because the hospital lobby's been so strong for years. They won every battle, and now they can't win this value-based care battle. There's no money left in the Medicare fund. The GOP majority wanted to undo it. They tried 2 or 3 times. They couldn't. You had a director of Health and Human Services for several months before he left, Tom Price, who was a physician who wanted to undo the Affordable Care Act with every fiber in his body. He said that several times and wasn't able to do it simply because there's no money to pay for a system where there's no checks and balances. And so right now what we're hungry for is an insurance model where there's checks and balances to make sure that care is only provided to people when they need it, and it's done so at the lowest level of care needed.
Do you think things could have been different at all in this situation had they adopted more of a cash-based type model, maybe in conjunction with insurance payments?
I don't. The biggest struggle right now is that nobody in DC has ever been debating bringing the cost of healthcare down for you and I or for corporate America. They've just been debating who's going to pay for it, the taxpayer or the individual. And the reality is the individual hasn't been able to afford it for years. And now the taxpayer and the corporation in many cases aren't even capable of paying for it. So 2018 has really become the year that America declared war on healthcare. It's been exciting to see. So in January this year, my book, Health Wealth, Is Healthcare Bankrupting Your Business, came out, 9 Steps to Financial Recovery. Guess what's happened since then? You had Intermountain Healthcare, Ascension Healthcare, a bunch of others join together and fire their pharmacy and say, we're going to create our own generic pharmacy because we're hospitals and we can't afford healthcare. You had Disney in Florida say, we can't afford healthcare. Disney, you ever heard of that company? They fired their insurer and said, we're going to start our own HMO and contract directly with the hospitals. Everybody's heard, of course, of JP Morgan, Berkshire Hathaway, and Amazon saying, we can't afford healthcare. You ever heard of those 3 companies?
Oh, geez.
They can't afford healthcare either. They're getting rid of it, blowing it up and starting over. Apple says, we're going to put clinics on our campuses. And then the best one of all, the one I love, is Walmart, the most efficient company in the world at cutting costs. Said there's only one cost we can't control, and that's healthcare. So if you can't beat them, buy them. So they're going to buy Humana so they can control their costs. So this is definitely the year of health wealth and the year that America declared war on healthcare spending. And regardless of a GOP majority or not, there's finally a discussion now about bringing the cost of care down instead of just shifting the burden of who's going to pay for the outrageous hyperinflation in healthcare.
Well, very good. Well, appreciate your comments about that particular issue. We're going to take a quick break, and then I've got a couple of final questions to ask you, just in general healthcare futurist type stuff. So we'll be back right after this. Hi, this is Steve Thornley, Care National's CEO. Well, you asked for it, and now we're going to provide it for you. HEDIS training and certification. If you are a nurse or other healthcare professional that has been dying to get into the HEDIS world and work a HEDIS project as an abstractor, you can now go through Care National's own training and certification program, offered by Kim Williams, a certified professional in healthcare quality. This training will give you the fundamentals that you need to be successful on your first HEDIS project assignment. For more information, go to HEDIScertify.com and get registered. Training will begin August 16th, 2018. Thank you. You know, with the Centene announcement yesterday on CNBC on Mad Money, the CEO of Centene announced that their balance sheet is basically going to hold a $69 billion value after they complete the acquisition of Fidelis, Fidelis is a very well-run healthcare organization or health plan organization, and you know, with these types of trends, it seems like the insurance companies are just getting bigger and bigger. How do you think that's going to translate out in terms of care, in terms of premiums, all that kind of stuff?
Well, it's hard to put Centene in the same kind of category as the Bucas, you know.
Because they're more government-based, Medicaid.
Yeah,
Medicare,
and it's
right?
more Medicaid, and
Right.
you know, there's a lot of you know, social mission involved in what Centene's done as well. And I can't speak to their new acquisition if that's still the case, but what I do see happening is providers becoming insurers and insurers becoming providers. Ultimately, the hospital, the provider, the physician provider lost their influence in the process several years ago for the most part, and now hospitals are next, and it's ultimately just follow the dollar back to where it originates from, which is the insurer, right?
Correct.
So now the hospitals are becoming less of a priority, and so what I often communicate to hospitals is, why don't you flex your muscle now while you still have one, and see if you can start your own insurance company or partner with the one who ultimately is going to have all the influence and power over you. And when people say, you know, they're not on board with that, I say, well, look at nursing homes. They have no say in the matter with insurers. They have never even had a seat at the table or a conversation, and can really rarely get somebody to answer their phone to talk to them about the care they're giving. And hospitals are largely going to become the same, just a commodity in the process eventually. If there's two hospitals in town and one gives a better rate, then the other one's going to be out of luck. And the gamesmanship that's been around for years, where I just, you know, bought off this one doctor through a medical directorship, or paid he or she in some way, shape, or form to keep the market share in my hospital. The federal government's gotten really good at learning where those loopholes are and really squeezing them out. So I do think you're going to continue to see consolidation. I do think there is definitely an era of transparency coming to healthcare that hasn't been there before, that's being demanded. There was a recent bill that required hospitals to post prices, which, by the way, was already passed during the Affordable Care Act, but they ignored it because there was no penalty if they didn't do it. So in terms of the transparency that's coming to the healthcare sector, I remain hopeful that it'll come. I would encourage individuals that are thinking about, hey, how do I make healthcare affordable for my family, or even for my business? You know, we have a portal at health-wealth.com, so healthwealth.com, where you can take an assessment and see how much money you're leaving on the table, whether for your family or for your company. We have a podcast where you can listen to all kinds of different strategies, but it's really about becoming an EHC, an engaged healthcare consumer. And really what that means is focusing on the 3 Ps, having a plan that's based on preventative medicine and personalized medicine. That means getting your DNA testing done, or your full DNA sequence, so you know which medications are effective on your body and which ones your body doesn't metabolize. That's a real science, and I've had people come up to me and say it changed their life in huge ways when they did that. It's about your diet. It's about finding a physician who's a direct primary care provider who will spend time with you each day. We're seeing DPC, direct primary care, really sweep the nation. It's about being willing to embrace and accept technology like telehealth and remote monitoring equipment. It's on your phone, it's in your hand, it's in your home. It makes a doctor's visit a lot more accessible and simple. And I will just say, you know, in closing, it's about accepting an integrative medicine approach, which is really going back to prior to Western medicine, when Eastern medicine was the norm in America, before Big Pharma squashed it and convinced us if we're ill, we need a pill. And what that means, integrative medicine, is just live healthy, eat the right foods, understand your body through your DNA test, understand how your body reacts to different foods, drugs, and exercises, and consider all options in living a natural life before you simply rely on Western medicine, which is really what we were kind of brainwashed to do as Gen Xers, which is if you're ill, you need a pill and go to the hospital. Well, I think the pendulum's swinging back to where Eastern medicine tactics are not positioned by the media as witchcraft, but an everyday part of our life, because they're natural, they're not Eastern, and they're not witchcraft.
I was just going to ask you, so do you think naturopathic medicine is going to make a real big resurgence?
Absolutely, there's no doubt about it. It's part of the millennial culture. It's
Sure.
part of technology being at your fingertips, understanding what you're putting in your body, understanding how you're treating your body. All these different things are making a reemergence. And I think you've seen it largely with those who have a chronic disease who are looking for an answer. But now you're starting to see it more mainstream. You're seeing these clinics pop up that are specifically focused on Western medicine, natural medicine, or excuse me, Eastern medicine, natural medicine. And you notice they kind of shy away from the Eastern medicine moniker because it was given such a bad name by the pharma lobby that wanted it to have a bad name. So,
Right.
so yeah, we're looking to see that pendulum swing back.
Okay, fantastic. Well, I mean, you brought up some subjects today that I think I could create probably or 3 or 4 more programs. Very interested in the DNA sequencing. We may look into that a little bit more. Definitely seeing these, you mentioned Intermountain Healthcare, a client of mine that I think is doing great things in innovating their health system. I'm really interested to see how this works out with organizations like them and others manufacturing their own pharmaceuticals. So a lot of good things. Healthwealth.com is your website.
Yeah,
Or
health-wealth.com.
health-wealth.com or drjoshluke.com. Of course, you can get his books on Amazon. Forbes Books is the publisher of his. Did they publish your first book there too?
Yeah, they published Health Wealth, so
Okay, Health
Execute was
Wealth.
self-published. So
Okay, very good. So if you want to become an engaged healthcare consumer, go to Amazon, buy his book. I've got my copy right here. It's my Health Wealth, or it's my Bible of
Thank
what
you.
to do for myself. So it's a great read, and hopefully again we'll have you back on another program to bring your expertise to the show. Thanks again for coming on Managed
I'll
Care
look forward
TV.
to it.
All right,
Thanks
so
for
much.
having me.
You bet.